Hey everyone, I'm your host Elizabeth, and we're still at Speak Resort Munyonyo for the Safe Motherhood Conference. And we have been speaking Safe Motherhood Conference. I have the best person to introduce himself and talk more about Safe Motherhood Conference so that you can learn and know what is it all about. Why are we here? Why are we spending 3 days for this third edition for Safe Motherhood Conference? Hello, Doctor.
Hi, delighted to meet you.
A pleasure. I would like you to introduce yourself, your name, and why are we having this conference for Safe Motherhood?
Yes, my name is Dr. John Paul Bagala. I'm an obstetrician and gynecologist and a technical officer for Safe Motherhood at the Ministry of Health. We are here for the third National Safe Motherhood Conference. Third meaning that for the past 3 years, we've been consecutively convening as a country to discuss safe motherhood issues. Safe motherhood, when you unpack safe motherhood has 6 pillars. Those pillars include family planning as a first and very important pillar. Second pillar is antenatal care. The third pillar is obstetric care. The fourth pillar is newborn care. The other pillar is postpartum care. And then the other pillar is prevention of STDs or management of STDs. So those are the pillars of safe motherhood. But the safe motherhood sits on a very solid foundation of increasing equity to access of services amongst women and girls, including adolescents, and ensuring that the literacy levels of young girls, women, and adolescents are increased because that has a ripple effect to their lives, their health, and their way of living. The other piece is also partner collaboration and involvement of male or the men in supporting women and also enabling having an enabling environment that empowers women but also gives them that ability to seek out for the care, to take decisions and make decisions for themselves and ensure that they live a quite very healthy life. So that is safe motherhood in its totality. Now, every year we convene, reflect on how are we progressing as a country as far as safe motherhood is concerned. Which gaps do we have? Which challenges do we have from the previous year? Every year we set particular targets, and so for every other convening, we have to assess our progress in achieving those particular targets that we set before, and we are able to look internally and deeply have difficult conversations why we didn't achieve particular targets and what we need to do differently to ensure that those particular targets are achieved. So that's what the Safe Motherhood Conference is about. It's the biggest national convening. This time round, we've convened over 560 participants, and these include health workers, frontline health workers, midwives, nurses, doctors, and other allied healthcare professionals. We have development partners, implementing partners. We have colleagues from local government, which is a very important department of government. We have policymakers, we have researchers, academia, scientists who are here with us, and there are lots, close to over 200 scientific papers that are going to be discussed in this conference today. So we are quite excited that we have this. But before this conference happened, we've had a series of multi-stakeholder engagements, and all that happened in the month of October. So you look at October as our Safe Motherhood Month that enables, and we try to rally everyone to ensure that the conversations we have strongly at institutional and national level are really centered around safe motherhood. So we had an engagement of media, and we're discussing with media what we need to do more with media on safe motherhood. We had an engagement of religious leaders. They made their commitments, and we also had an engagement of the young people. The young people had the youth and adolescent pre-conference for the Safe Motherhood that was last week, and now we have the National Safe Motherhood Conference, which always wraps up all these activities, and that happens every last week of October. It's been quite a mouthful of explaining safe motherhood, but yeah.
from the viewer's point, I think Dr. John Paul has dived into the right information about self motherhood and what it is all about. So, Dr. John Paul, we are this target this time around is teenage pregnancy. Now, heading to that topic, why aren't the children very comfortable speaking this to their parents or to the religious leaders? But they can confide best in their best friends who are still teens, and then they all don't have the right information. And they just head for two things: go abort because you're ruining your reputation, or it's not accepted in the African setting. So, what is your say, Dr. John Paul, about this?
Yeah, we I think we haven't reached the last mile as far as supporting our young people is concerned. And we still have to do more. We agree from our current statistics with our teenage pregnancy rates at about 22%. They reduced from 25%. Based on the recently released Uganda Demographic Health Survey indicators, it still means that we have a lot to do. And there are different factors, driving factors. One, the information. We haven't, I think, yet, although we are planning to see how appropriately can we ensure that we have that age appropriate information given out. We haven't nailed it. We haven't got the right solution that enables us reach the last mile. But we have a series of partners that are very keen to work with us in this space, and they're quite very, very interested to work with us. And like the Nagulu Teenage Center, Reach a Hand Uganda, that are willing to partner with us as government so that we can, run through, we can get more extra pairs of hands that can work with us to ensure that we reach more adolescents. Other factors, of course, that are really affecting this. Poverty is another issue that is really hitting the young people. And definitely that goes back at home, the homes where they come from. If the young people are not able to are not able to obtain what they want, or families, parents are not able to give them some of the essential items they need in their life, then they try to use alternative means to acquire what they want. And some of these alternative means are extremely risky. And we've seen a number of them get the unwanted pregnancies as a result of that. But also, it's very important for me to say that our school dropout rate still remains another critical issue. And that is caused by a number of factors. And still, one, if a parent cannot afford school fees, then you find that girl or boy sitting at home. But what results from this idle mind are some evil acts that they are pushed into to keep themselves busy. So as a result of that, then we see a lot of the teenage pregnancies arise. I think the parents, the issue of addressing teenage pregnancy is a pronged approach, and it requires several players on board. Everyone has a responsibility to play. It's not only government's responsibility to address this. The parents have a very huge role to play in here. The issue is going back: how are we bringing up our children? What words are we telling our children? How are we preparing them for the future? I think those are very difficult conversations sometimes, that if some parents did not have such an experience when they were still little to be talked to by their parents at the time, then that we see that ripple effect, or we see that spill off in terms of their inability to have such difficult conversations with their children as well. But times have changed. Times have changed. Young people are having access to phones. They are Googling all kinds of information. And I think, and what we're trying to say, that in our multi-stakeholder engagements, the cultural leaders, the religious leaders, and if you listen to the permanent secretary today, she was very clear that our colleagues, the Muslims, pray over five times in a day. But in these prayers, they're meeting parents who have young ones at some point. I mean, the Christians also pray every week. If we integrated some of these messages in the church preaching, I think that would be very, very complementary in our efforts to ensure that we cascade the message to the last mile. So I think some parents have difficulties in saying some of this information. Some parents are equally shy because they have never experienced it before. They didn't find it in their time. But I think we have to create spaces as well. That as we continue, or as we plan to talk to the young people, we must also talk to the parents. So we need to have very solid conversations with parents as well, and also help them, support the parents to tell them what information, age appropriate information, they should tell to the young people. Because if we don't tell the young people will be forced to look out for that information by themselves. And at the end of the day, we don't know what information they're landing on. So it remains a very, very challenging situation. But as the Minister of Health, we have put in place a mechanism to see how do we cascade this information to the greatest extent possible, and how do you ensure that every single young person who feels that they have that question, that inner itching question that their parent is not able to respond to, they can call through our call center, the Ministry of Health, and then we put them in touch with support officers that can address some of those interesting questions that they may have. But I also know that Richer Hand has something that they're offering in that space. I also know Nagul Teenage Center have something that they're offering in that space. We have to make those platforms as robust as possible because the population is rapidly increasing and the demand for this information is also equally rapidly increasing. Yes.
Thank you so much, Dr. John Paul. So my last final question is going to be you advising the elders out there, because we look towards our elders. When the elder tells you something, we listen. But then I'm requesting you to kindly advise your fellow elders about how they can deal with children, adolescents who are teenage mothers or who are already carrying this pregnancy, or who have made the wrong decision and maybe they have gone ahead and they have aborted and they're having issues like fistula happening to them and they're not comfortable enough to talk to their parents. Yes.
Yes. So, as you've said, our parents out there, let's have these difficult conversations because if we don't have the difficult conversations with our children, they will work very hard to find that information from someone or from somewhere, and those sources may not be safe. So that's one. Let's sit down with our children. Let's sit down with our children, and the opening question can be, how are they finding life? That question alone can unlock a number of responses from this young person. Let's build relationships with our children. They shouldn't see us as uh, police officers. They should see us as their peers at some point because they are able to say and have these difficult conversations with their other peers. How do we create an environment that will make them see us as their fellow peers, that they can open up to us and tell us as much of their inner secrets as possible? Because there is no other person that will have the best interest for this young boy or girl aside the parents. There is no other person out there that will understand them more than you, the parent, to this particular young person. So it's also very important that we, as we continue to create platforms to support the parents, because as I highlighted, some parents don't know what to say. They have these difficulties still. We encourage parents to call in our Ministry of Health call center, and then we can guide them. We can guide them if there is some difficulty that they are facing with their young ones at home. We can guide them. We have teams that are professionally trained and can guide them on how they can circumvent those situations. Of course, we have to work hard as parents. We have to work hard. An excuse that we can't pay tuition or we can't pay fees becomes extremely very hard. But we know times are a bit difficult, but let's work very hard and ensure that we keep our children in school. Let's give them that opportunity to build a future. Being out of school, there is no guarantee that the future they will have at any point in time will be successful. We don't have that guarantee. But at least we have the guarantee that if in their school, at least they have a career for themselves. And also, there are things that we can delay if their minds are kept busy and they're kept innovative on the other aspects of life, which are more productive. That's in terms of academia than them being out of school, where we may end up losing them to really very risk life behavior. So, in a nutshell, that's what I can say, and as the guidance that I can give out to my fellow adults out there.
As we have heard from Dr. John Paul, is let's have these difficult conversations as parents. Let's sit down on the round table with our children. Let's have those dinner tables. Even just Lusani at home on a Sunday, we can come as parents and we talk about these issues that are happening so that we try to reduce the number of teenage pregnancy that is skyrocketing in our country, and we have a better future for this generation that is coming, and that we have a better Uganda as a nation. And he has said a lot, and he has talked about each and every information. And if you feel this is vital information, please like, share, and comment on our different social media platforms, Sauti Plus Media Hub, Sauti Plus TV. Let's share this information. Let's try to make sure that our generation is better, that our country is improving, and that our teenagers are in school and still safe and sound, and they can build a better future for themselves. I remain Elizabeth, and we are still at Speak Resort for the Safe Motherhood 3rd edition.